Migraine is a condition where patients have repeated episodes of head pain that is often associated with other symptoms such as nausea, vomiting, and light sensitivity.
Well, we describe migraine as a brain disorder where the brain is hyperactive and the manifestation of its hyperactivity is a headache.
Migraine is a type of primary headache, meaning that the headache itself is the problem as opposed to headaches that are due to other secondary causes.
A lot of doctors actually make the mistake of saying migraine equals headache, where really migraine refers to a collection of symptoms that can include head pain for some people, light and sound sensitivity for others. I like to think of the migraine brain as this super sensitive smoke alarm. It's basically going off with these signals of head pain and light sensitivity and nausea whenever there's something else not quite right going on with the rest of the body or with the environment around it.
The way that you know that you have migraine is based on the kinds of symptoms that you get with some of these headaches. If it seems like you're experiencing headaches that have that throbbing quality, one side worse than the other, the associated symptoms that aren't necessarily pain in addition to the headache pain, that leads you towards asking the right question, which is, could this be migraine? And it's important to ask that question because the treatment that you would have for migraine is different than the treatment that you would have for many other kinds of headaches.
So the diagnosis of migraine is really a clinical diagnosis. So by providing an adequate history of your headaches, your healthcare provider can then ask some follow-up questions and determine whether or not the headache is migraine or is another type of primary headache such as tension headache, or if the headache is due to another cause altogether.
Well, there isn't a cure for a migraine because we think of it as a genetic disorder. However, it's a very treatable disease.
Well, there are lots of options for treating the head pain in the moment. I would recommend that you see your physician to discuss the best option for you, but things that are out there right now are over-the-counter regimens such as non-steroidal anti-inflammatory medications like ibuprofen, and then there are other prescription options. Some people also feel that symptomatically during a headache, things like using cool compresses or going in dark rooms can help as well.
Migraine medications for the most part are safe. However, they are attached to certain side effects that may contribute to illnesses or drug-drug interactions that can be unsafe. So before you consider a medication, you and your doctor should go over the medications that you are currently on, take a look at the drug-drug interactions to see if it's anything that could be potentially life-threatening, and also take a look at your current condition, any medical conditions you have, and see if the medications that you're considering would best be agreeable to someone in your medical state.
I think the most important thing for patients to know is their doctors can really be their advocates. And it's very important for them to be very open and to ask any question, because no question is a stupid question. And all questions, really invite discussion. And it's very important to ask away and to use the resources of a neurologist or headache specialist, especially if you have concerns about your headache.